Point of clarification. It's not an either or, is it 1332 or 1115? Or can there be a combination of waivers?
The 1332 would encompass the 1115. So it would be unusual to file an 1115 and then file separately for a 1332. I mean, I would think the more efficient way to proceed would be to make a decision that you wanted a unified waiver and you would incorporate the 1115 components into your 1332. I think that would be the better approach.
Okay. Because some part of the 1115 with the independence accounts and the health savings accounts is what was used, that vehicle, we use that vehicle for those certain things. This is maybe just a strange question, but I sit and I wonder why. Like, why put the 1332 into the ACA? I don't know if you can answer that question, but it just seems like states did all these different things, and the ACA kind of came and flipped it upside down, and then now we're flipping back again upside down. And I'm frustrated by what seems to me a huge lack of inefficiency based on, I guess, public policy created that inefficiency. But for states, like our state, I mean, we have different political persuasions here, obviously, but our general baseline here is that we're under a balanced budget requirement. So that really does kind of level a lot of us when we want to do more. However, you know, it may mean that education might suffer, or we have obviously corrections pulling at us. So it's interesting to me because I just see a ton of money on trying to continually change, which seems to be realized by a lot of healthcare consulting companies and lots of different folks out there that I know are in the audience, so I'm not to be offensive, but there's been a tremendous amount of state funds and federal funds spent in that arena, which seems to be taken away from actual health care for individuals. Don't know if you can answer that question, but we'll try.
You know, as you know, the federal government has no such balanced budget requirement, which may explain why things happen the way they do. What I would say is that I think the Affordable Care Act is the most complex piece of public policy in American history. I think that is a relatively controversial statement. And the reason why is because on the one hand, it does completely alter the federal-state balance with respect to health care. As all of you know, health care was primarily a state concern before the Affordable Care Act. Now, it's difficult to argue that's the case. I suppose you could still make an argument. You know, I think the innovation waiver provision is in there because, frankly, there's a lot of things in the law that got there and no one really knows how they did get there because the legislative process was quite complex. I think it's there, as I mentioned in my testimony earlier, because a certain senator really wanted it there, really felt like that was important. And I think, quite frankly, there are pieces of the Affordable Care Act that could be used in constructive ways, while I think the law as a whole has some significant challenges. It's tough. I think it's the conglomeration of a lot of different thoughts, and they're not all consistent, and they're not meant to be, and that's part of the reason why the law is encountering the challenges it is, whether judicial, legislative, or otherwise.